Nagbabalik po ang Good Morning Kapatid. Importante po para sa mga kababaihan ang pagkakaroon po ng proper feminine hygiene. Bukod sa pananatiling malinis ito, makatutulong din po ito para makaiwas tayo sa mga sakit. Yan po ang pag-uusapan natin ngayong pagdiriwang ng Women's Month. Kasama po ang ating resident morning doctor na si Doc Richard. Good morning, Doc!
Good morning, Mommy Dames. Happy Friday!
Happy Friday!
Yes, and good morning din po sa ating mga kapatid. Para po idetalya sa atin ang tamang hygiene para sa mga babae, kasama natin ang OB-GYN na si Dr. Ivy Carandang-Embuscado. Good morning, Doc Ivy.
Hi, good morning.
Morning, Doc.
Good morning.
Thank you for coming over. Very, very important for us to discuss this kasi kadalasan sa atin, I guess, I don't know if sa kultura lang natin ito, parang nakahihiya tayong i-open up yung mga ganitong klase ng bagay until such time na meron na tayong napansin na problema. So, this time we talk about proper hygiene first before anything, no?
Yes,
Oo,
napaka-importante talaga niyan, Mommy Dames. Pero umpisahan na natin, no? Doc Ivy, bakit nga ba importante ang proper feminine hygiene?
Yes, it's important because makakaiwas ka talaga sa mga infection which could later on lead to infertility kapag hindi mo naagapan. And then, mami-maintain mo rin yung normal vaginal pH. If you maintain your normal vaginal pH, makakaiwas ka sa mga smelly discharge down there. Mas maganda yung sexual intercourse ninyo. And makakaiwas ka sa mga sexually associated infections.
Doc, himayin ko lang. Yung umpisa, you said na nga yun yung very first one, na yung sa infertility. Ibig sabihin, yung mga nahihirapan magkaanak, maaari na isa sa mga rason nun ay dahil hindi nakapagkaroon ng proper feminine hygiene. Hindi man ibig sabihin nun na you didn't do it at all. It's just that it was not the correct way, correct?
Yes. Because kung hindi mo inaalagaan yung inyong vagina, nagkaroon ka ng infection, hindi ka nagpatingin, pwedeng umakyat ang infeksyon sa matres, umakyat sa tubo, umakyat sa ovaryo, yun yung mga pelvic inflammatory disease which could later on, pag gusto mo nang mag-anak,
mahihirapan
mag-block
ka.
na yung tubes mo.
Ay,
ganun.
tignan mo yan. So, pwede rin pala yun. Kasi so many factors now, di ba? Parang sabi nila, bakit gano'n hirap ako magkaanak? Pwede pala yun. Yes. And then yung kanina naman, you were saying nga na parang it could also lead to smelly disorder, no? Ang hirap. Okay. Pero ito naman, Doc, no? Sa usapang personal grooming, gaano ba kadalas dapat naguhugas ng ating intimate area? At paano ba ang tamang paghugas ito? Kasi dati, pag nagkakaroon ng UTI, di ba, tinuturo bigla yan ng OB-GYN na paano ka ba mag-wash? Yun ang unang tanong para at least wala namang judgment kung ito ba yung way mo, di ba? Ang hirap kasi sa atin, ang dami yung mga sinasabi ng matatanda na ito dapat, ganyan. So Doc, once and for all, para sa ating mga kapatid watching right now, ano nga ba ang tamang paghuhugas ng intimate area natin?
Okay, so first, after you pee, you should wipe from front to back, never from back to front.
Naku, that's so usual pa man din, di ba, na parang pag ganun. Why front to back?
Because yung bacteria from behind, sa anus mo, mapupunta siya sa taas.
Ay,
So dapat make sure, always think na dapat pag mag-wipe ka ng wipes from front to back, and you should wash as often as needed. If you feel itchy or if you feel na, basta any moist bacteria, ang pag-wet kasi down there, it's a culture for bacteria. So sweat, blood, anything na mag-moist down there could cause bacteria to grow up.
Doc, sorry, ilagdag ko lang. Pag may bidet ka sa bahay, di ba, ang water usually, some people wash from behind and some people wash from front. Anong tama? Front din? Palikod, no?
That's correct.
Okay, sige. Okay. And always keep it dry.
That's correct.
How true na wag daw masyadong gumamit ng tissue paper, lalo na pag ang ply ay manipis kasi pwedeng naiiwan doon yung tissue?
Okay lang naman gumamit ng tissue. However, some nga, naiiwan doon, nasa stock up and then hindi na na-wash off. So, foreign body could also cause smelly discharge.
Okay.
So, ganun pala yun, Mommy Dames, no?
Yes.
Harap,
Palikod.
papalikod. Pero in terms of doon naman sa mga cleanser o kaya sa bundok, may mga recommendations ka ba na kailangan gamitin para sa feminine hygiene? Or may mga sangkap ba na kailangang iwasan?
Oo. So, we should not use yung mga regular soap or yung mga regular gel kasi it's meant for the surface of the skin. Yung skin kasi natin, iba yung pH level niya. our vagina has a pH level of 3.8 to 4.5. So kapag iba yung sabon na ginamit mo, hindi siya doon akma sa pH level na yon, pwedeng mag-accumulate yung bacteria, mapapatay mo yung normal bacteria ng vagina.
Dok, ito may phone-in question tayo galing sa mga kababaihan behind the camera dito sa studio. Everyday daw ba dapat nagpa-panty liners?
Okay lang mag-panty liner, but wag naman po yung may mga patients kasi they use it the whole day. So you should change as often as needed. If you feel wet down there, change as often as
Pwede.
possible.
Also, what's the best textile for an underwear? Kasi I know a lot of people na get irritated by certain fabrics. Ano't pinaka-okay?
Cotton po.
Cotton.
And
Oo.
any loose clothing. Kasi any tight wearing na underwear, like yung mga cycling na sobrang sikip, could trap the air and heat down there. So magmo-moisture, mag-wet, sweaty. So mag-accumulate na naman yung bacteria.
Doc, okay. I know this is kasi this information, I know dahil sinabi to sa akin na when you sleep daw, some people actually go commando and not have any because nga to air it out. Is that true?
Yes, but possible din.
Oo,
Pwede din.
para nare-relax
Pero
din,
kasi
no?
baka uncomfortable din. So mas better na lang na use cotton clothing or loose underwear.
How about for feminine wash? Kasi sabi sa akin dati na pwede naman water lang daw okay na. Pero ang feminine wash, gaano kadalas pa dapat ginagamit?
You can use feminine wash as often as you want.
Okay.
Basta yung akma sa pH level of the vagina. And FDA approved, of course.
Oo,
Do
yan.
not use yung mga napapanood nyo lang elsewhere because baka meron siyang component na hindi akma for the vagina.
Okay. Oo. Ito naman, Doc, ano ba yung mga komplikasyon na maaaring iwasan sa pagkakaroon ng proper feminine hygiene? So if we actually practice good, proper feminine hygiene, ano yung nasispare tayo into experiencing?
So first, nakaka-avoid tayo magkaroon ng UTI, yung mga sexually associated infection like the vaginosis and the yeast infection. Kapag napabayaan mo yun, aakit yun, makakaiwas ka rin sa pelvic inflammatory disease, yung mga smelly, fishy odor, maiwasan mo yun. And yun.
Okay.
Sobrang dami pala ng pwedeng complication
Yes,
na
no? Kasi
maiwasan.
di ba parang sabi nila in the same way that you have to take care of your teeth and ano kasi nga it's the entrance. Ito rin, di ba? Very, very intimate talaga.
Yeah, pero Doc, in terms of doon naman sa menstruation, gaano nga ba kadalas dapat magpalit ng sanitary pad?
So for sanitary pads, Doc, every 3 to 4 hours. Or if heavy yung flow mo, change as often as needed. Pag if you use tampons naman, 4 to 8 hours,
4 to 8
not more
hours.
than 8 hours kasi meron tayo yung toxic shock syndrome, yung forgotten tampon syndrome,
yes.
no? And then we also have the menstrual cup, pero dito sa Pinas ata hindi masyadong
Hindi
ginagamit. So every 10 to 12 hours if you use menstrual cup.
Okay. Doc, ano naman yung mga proper hygiene tips na dapat tandaan ng ating mga kababaihang, mga kapatid at the moment, lalong-lalo na ito yung isa sa mga bagay na nakakaligtaan natin gawin, di ba? O, kapag meron silang menstruation.
So first, yun nga, as I've said, always think that the blood is a culture medium for bacteria.
Yes.
So anything na nakababad yung vagina mo sa blood, pwede kang magkaroon ng infection. So change as often as you can. Dapat keep it clean down there. Tapos use a feminine wash na with balanced pH.
Yes, oo. Ay, ang ganda. And also, Doc, yung pagka sa anything na iniinom naman. Kasi di ba they say na milk daw is good, lots of water. May correlation ba yan siya? Wala.
Yes, we also recommend mga probiotics, especially for those patients that have recurrent vaginal infection, those who are taking antibiotics for long term, nasisira yung normal flora ng vagina nila. So we recommend you can take oral probiotics and we also have vaginal probiotics.
Ayun.
At lagi nating sinasabi, Mami Dims, no, uminom ng maraming tubig.
Water talaga.
Yes, water.
0 calories, di ba, Doc?
Yes,
sabi mo?
hydration is the key. Pero Doc, sa usapang vaginal discharge naman, ano naman yung normal na vaginal discharge at paano nga ba malalaman ng ating mga kapatid kung may problema na ito?
Oo. So, palalaman mo kung abnormal na yung discharge mo if it's different in color, if it's grayish, yellowish, greenish, may amoy na siya, smelly, fishy odor, nangangati na yung puwerta, may pamumula. So, yun na yung mga warning signs that meron ng abnormal vaginal infection.
Take note mga kapatid ha. Note nyo na yan.
Yes. Oo. Ito naman, Doc.
Oo.
Oo.
Pero Doc, kailan dapat magpakonsulta sa isang OB-GYN patungkol sa vaginal discharge?
As I've said, yun kasi yung normal. So whitish lang, hindi siya makate. Pero if nagbubuo-buo na yung whitish discharge mo, parang cottage cheese, nag-iiba na yung kulay, meron
May
ng
amoy,
smell.
yes.
Usually kasi yung normal smell ng vaginal discharge, wala siyang smell. But if it's something fishy, iba na.
Magpakonsulta
Kailangan mo
na
na
agad.
magpakonsulta.
Oo. Ang ganda! Doc Ivy, maraming salamat. And I'm sure marami sa mga kababaihan na nanonood sa atin ngayon ang talagang na-inspire to really take care of themselves. Kasi nga, you were saying na it could go as serious as not giving birth to a child because pwede talaga ma-infect ang iyong womb. Maraming salamat, Doc Ivy,
Thank
for
you, Doc
coming here
Ivy.
today. At syempre, bago po tayo magpaalam, babatiin natin ang ating paborito, Morning Doctor. Congratulations si Doc
Nako.
Richard po para sa kanyang Silk Award for Ultra-Cold Collagen Biostimulation. Doc! Ayan
you.
o!
Ay,
Wow!
nako. Nako.
Richard Gadiaza, MD!
Ay.
Oh,
Ay,
diba?
paganyan. Nako.
Yes! Doc, you wanna say anything? Kasi this is such a big, prestigious award, no?
Yes, thank you. Thank you, Jim, for the acknowledgement. And this is for our patients na naniniwala na aesthetics can really transform lives.
Agree.
Yes,
At,
maraming salamat.
yes. Cheers to more. Congratulations,
Yes, cheers
Doc.
to more.
And
And
we're super,
sorry,
super
Mami,
proud.
thank you
Yes.
also Skin Medicine for the recognition.
Ayun. Skin Medicine.
Skin Medicine,
Maraming
thank you.
salamat for recognizing the hard work of our resident morning doctor here. And Doc Ivy, thank you again for coming over. At sana ay marami pa kaming mapulot sa iyo where anything that we can go to, like a social media account or your clinics.
You can visit me in Pacific Global Medical Center at Mindanao Avenue, Quezon City, or follow my TikTok, Doc Ivy. Thank you.
Ang ganda. Alam mo, I'm so happy that all our doctors now, whenever they come here, they really have their TikTok accounts.
Yes.
Kasi dyan na talaga is one of the
Yes.
best ways to market and to be able to create awareness.
It's a good platform.
Yes. Thank you, Doc Richard, and thank you, Doc Ivy.
Mga kapatid, Dimples Romana po, kumpletuhin ang inyong umaga ng mga kwentong puno ng inspirasyon. Salubungin po ang bawat araw ng may ngiti at pag-asa. Kaya't mag-subscribe na po at mag-follow na sa aming social media pages ng News 5.